Hey, Leah. We are waiting on Lisa. Okay. You logging on? All right, you guys, we're just waiting on Lisa. I want to make sure we're having an okay time connecting here. Leah, let's talk. We can make it happen. Let's see. I just did international this week, Leah, but we can definitely do some US acupuncturists. Perfect. All right, Lisa's here. Let's set this up.
Are we there?
There
Hi!
Hi!
Oh my gosh, how are you?
No, it's you in the flesh. I can't believe it.
Yeah, it feels a little surreal.
It is a
So
little surreal not
it's
having
so
seen
nice to
your
see
face.
you though.
Yeah. How are you doing? How are you holding up? You said you're in the countryside?
Yeah, we moved out a couple weeks ago already. I mean, with luck, even before we knew that this whole, not to start the whole thing, be like Corona, but like,
Yeah.
before it even broke out, I was already going on to my maternity leave. So it
Okay.
kind of worked good. And we were going to move to the countryside anyway. So I've been isolated here pretty much for the last month. But I don't take isolation as a bad thing. It's more like a luxury.
Yeah.
We're just kind of out here enjoying it. But yeah, we're doing okay. I mean, like everyone else, of course, the stresses of just kind of the odd times right now. But in
Mhm.
regards to me personally and my family, everyone's doing pretty good. So how are
Good.
you?
I'm I'm good. I mean, it's definitely weird here in LA. You certainly realize very quickly how many things you depend on outside of the house.
Mm,
Um, I'm still practicing. My practice is still open, but it's just very limited hours treating, essential only, and then doing
right,
telemedicine for all patients. Um,
right,
so that's just been an adjustment, and everything from like the Wi-Fi being overloaded to communicating with current and prospective patients and letting them know that this option is available. But like, I'm just thankful that we're healthy here. Derek and I are happy
right.
to spend more time together, and just like trying to adjust and still,
How
I'm
about
just so thankful.
like herb practice? Because I mean, again, we can get into this a little bit later, but I mean, you guys have herbs in California, which is something that is non-existent pretty much in Finland, which has been a huge adjustment for me in practice. Because as you
Oh,
know,
you're an
big on
herb person. Yeah.
yeah, so it's like I went in, studying acupuncture and came out kind of a herbalist. So I feel like I've had like a leg amputated in this process, which again we can touch base on that later. But how do you feel? Like, are you sending home herbs at all? Like, are you
Yeah,
doing any prescriptions at all for patients?
that's been the major switch. I'm primarily acupuncture, but definitely do herbs. And now it's like, okay, primarily herbs, and then some people can get acupuncture. So,
Got it. Right.
but I had talked to a woman, Molly, who went to Emperor's, and she's living in Florida right now. We talked last week, and we were talking about how all of the like typical patent formulas flew off the shelves really quickly. Like
Yeah.
everyone wanted to grab Yu Ping Feng Sung and Yin Chow, and we were like, wait a second, like this is a huge area of opportunity. Like this is a customized medicine we're supposed to be treating the root cause of what's going on, there are still plenty of herbs to be used. And I actually thought about you. We were having this conversation because I know how you used to just like personalize all of the herbs, and it was always really easy to learn herbs from you because, you know, they all had their little unique traits and personalities and how they all work together.
Yeah. Yeah, it's been
Yeah,
a huge
it's like
adjustment because
sparks the
here,
love.
yeah, I mean, it's interesting you say that because I had a bunch of both friends and patients and whatnot reach out. Some who had actually gotten sick and some who were more worried about getting sick. And, you know, obviously because I'm not in the States anymore, I've just been recommending some formulas. But then when I started looking at my normal resources, I mean, they were sold out. All of them were writing me back like, okay, that's great, but this doesn't exist. So
Yeah.
fortunately, you know, there are other options as practitioners because we have, you know, practitioner accounts. It's not always just these, so to say, standard formulas. We're able to do custom through other sources. So, and of course, as you said, it's better for people to go through a professional because you might be able to actually treat both at the same time, you know, get something that's good for your underlying condition, but then add in some of these, you know, enhancing herbs, or, you know, if you happen to already be sick, again, as we know, like you don't maybe want to strengthen the pathogen either. So there might be things that people are taking that might not be right for their condition at that moment. So again, it's still like with everything, I would still recommend always going through someone who's actually a professional and knows what they're prescribing. So again, as much as it's great that people are turning to TCM, it kind of goes back to some of the long discussions we've always had about like getting your products from a reputable source. So
Yeah.
yeah.
And, you know, I really am encouraging people, like you said, to go through a professional because I also don't want, you know, people, their first experience with TCM to be, oh, this is so exciting. Like, let me grab this typical immune formula. And then that's not the ideal formula for them. And then they turn into a person who's like, I tried it. It doesn't work for me. And
Totally.
maybe it's just that, no, you didn't have a doctor of this medicine who, you know, was there to prescribe this for you. This was something, you know, you kind of entered into experimentally. And this really is a complete system of medicine, and we need to be treating it as such. Um, so yeah, I think really interesting conversations are coming at this time, and people
For sure.
are being
Yeah.
more open. Like in California, people are already pretty open to herbs, but now I'm seeing much more of an openness because people are looking for solutions.
For
So
sure. For sure. I mean, again, like comparatively, it's just, I mean, it was one of those things coming to Finland. I don't know that I was really prepared for how different the environment was going to be. I mean, coming
yeah,
from
let's talk about that.
California.
How is it different? Like, what's
Oh
going
my
on?
God, like completely different. And both in good and bad, right? Because the one thing is that here, like in California, obviously you're primary healthcare and you are kind of considered a part of the healthcare system, and you can work with other doctors and do referrals, and you have so much more, you know, just coverage for patients. I mean, just getting covered by insurance and so forth, and all these benefits of being a part of the medical system. I mean, Finland is so far behind in that perspective that like we're not even a registered profession. Like we're not even acknowledged. Like we don't exist essentially on the map. And it's kind of not even just Finland. It's across the Nordics for the most part, and in Europe there's, you know, it's very much based on each individual country. So you kind of have to look at each one as its own perspective. I mean, that being said, in regards to the practice, I don't know that we're necessarily like too far behind. I mean, I think there are some really good schools. There are really good practitioners. I mean, I work with currently as a board member at the Finnish Acupuncture Association, Finaku, and there are people who have been in practice like 20, 30 years, you know, so it's been around. It's not like it's a non-existent practice. It's just that it hasn't been registered in an official way. And that's the pro with that, is that it actually leaves a lot of lenience to kind of do some of the practices that get banned when you start adding regulations. So
Yeah.
you don't have all the red tape, and you don't have all the issues, and you don't have all the legal paperwork and like all the same things that become a little bit overwhelming. But at the same time, you need those because you need to be able to regulate who's doing what. And right now it's the Wild West. I mean, essentially anyone could pick up a needle and practice. Like you don't even need to have really like an education here, and no one's overseeing that. And that, as you know, is like incredibly dangerous.
Yeah.
So I think that's the issue, that yes, you have some lenience in some ways, and you have the opportunity to kind of like, for example, you know, wherever, California, just because that's my experience, or US in the general, they've kind of built up through years of like building on old rules. And sometimes that gets a little bit in the way of just modernizing the medicine because you have so much red tape built on red tape. And
Right.
now Finland, because there's not really any red tape, it's an opportunity to take all the knowledge of all these other countries who have built systems and kind of go ahead of them and be like, hey, this country's done it this way. These are the things that really work. These are the things that are now just like a gray zone. We can skip all of that and just implement a lot more modern, like appropriate system, a more kind of integrative strategy, so to speak, which is the direction which I think is now, even across the board, we talk about in the association, this kind of integrative approach, instead of talking about like TCM and Western separate. I mean, they
Right.
are their own identities, absolutely, but we recognize the necessity of working together with other practitioners. So coming in with that mentality opposed to us versus them is really giving us a huge platform. So I see the pro and the con, but as someone coming, being like an acknowledged like practitioner and like being able to access herbs and like get blood tests and like do all this other stuff for my patients, I feel completely crippled, like no herbs, because essentially TCM herbs are not cleared in the country.
Mhm.
And essentially we have local herbs, a lot more of the like kind of westernized, you know, homeopathic and kind
Yeah.
of traditional European herbal medicines, but it's not the same as working with TCM because we have our whole own diagnostics. And I think that in my experience, I feel that TCM just has a lot like longer history and just a little bit more variety and treats a little bit more complex natured. Like, again, I guess some other herbalists might totally like come at me for the comment, but maybe it's also because of my personal experience. I just find that TCM has a little bit more intricate system. So I do
Well,
feel like my are cut off.
no, no, I'm wondering too though, like, is that part of your, I guess to me, like as an outsider looking in, it seems like that is what makes you such a great fit for being part of this association is that, you know, you were educated in California, like we both chose to get terminal degrees in our field. So then to hear like, okay, we did undergrad and then 4-year master's program and then 2.5-year doctorate and then you go to a country that's like, hey, anyone can do it all. It kind
Yeah.
of seems like a perfect fit for you to be able to add a little bit of perspective and see kind
Sure.
of the bigger picture and like both sides of things. Was that kind of your motivation for getting involved with the association, trying to bring it everything into Finland in the right way, or like what are you guys working on?
Yeah, sure. And I mean, there are some really proactive people here. Like I can't kind of give enough credit to actually a couple, actually a duo who built, started a school out here.
Yeah.
Thai and Nikal are their name, but they were originally part of like Finaku's board members. When I joined, they were the chairman and the vice chairman. And when I came there, I came with my arms open, kind of like, how does this work here? Because you know, in California, you go to the cab and you're like, all right, you do your license, and then you have this, and you have your insurance, and like it's a pretty clear step of what you need to just be in practice. Whereas here, it was really like a gray zone, and no one could really answer because you didn't technically have to be accountable for anything. They're like, well, technically, you don't have to, but we recommend it. And so the goal of Finaku, when I started like through them understanding, was really to elevate the profession. And I mean, ideally, the goal is to become a registered profession through the local, like, official Valvira. But it's a long process because, of course, they would have to oversee education. They would have to oversee, you know, insurances. They would have to, like, integrate it into the system, which ideally is the future. But, of course, we understand it's a huge process. And it reminds me a little bit of what, like, Jacques and Robert used to say back from, like, Emperor's days. For those tuning in who don't know what Emperor's is, we're talking about Emperor's College in Santa Monica, where we both, you know, graduated from. And they were talking about being on the front lines back in California when it wasn't a registered profession. And, you know, how they were first self-regulated and then moving into being like government approved self-regulated. And so that's kind of where we are now. You know, I mean, it
Yeah.
seems like so long ago, but it really is exactly where we are. And hearing their stories and how that process happened was really helpful. And so, of course, just having been in working in the school with you and having seen all this kind of how it works, I felt like I had a lot to offer. Not necessarily that that was my goal going in. I just realized that it was a huge gap and that I could maybe bring my experience and hopefully support working towards getting this profession to be registered.
Yeah.
And it's complicated because now Mikael and Taina have actually started the school, and they're now like I think in their third group. Like they take an annually, and
Okay.
it's been the first school, as far as I know, in Finland that really meets all the ETCMA criteria, which is the European Association association. And it's also something that would be more equivalent to like the schooling that we had for our like masters. So they're
Okay.
trying to meet all the criteria of these schools abroad, so that when the day comes that we have to say, hey, do we have a proper education facility, this facility would already meet all the criteria. We wouldn't then have to start building it. So they're
Uh,
keeping, even though they're not like required to do certain things, they're really trying to meet a higher standard to push students to meet a higher standard. And again, like I said, I had honestly no intention going in thinking that I was going to get this deeply involved kind of in a more political way and kind of looking at more building structure in this fashion. But then when I got there, I was like, I can't turn my back on this either, because I know that I have something
yeah.
I can offer from my experience. So
Well, and that's what I was gonna say. Like, it's just a perfect fit for you. So even though, like, you're saying you didn't go in with that intention, as you're explaining to me the areas of opportunity, I'm like, oh, that's a perfect job for Lisa.
it's kind of like working at Embers. It's like you have a job title, like you go doing one thing, but you're actually really good at something else. Like I've come to the conclusion that I'm just really good at organizing, and it's not
Yeah.
something that I particularly love, but I have this kind of very methodical strategy that usually, when like performed correctly, like usually works. And that's kind of what I'm seeing now with myself in this area, where I'm like, okay, looking at the school, looking at the association, looking at all these pieces, and trying in my head to see like how can I get them to come together in a really like Zen gardeny way, where everything is kind of supporting each other instead of working against each other. And unfortunately, when you have a situation where it is kind of the Wild West, um, it's not always such a like straightforward thing that people get along or want the same thing. Like in
Right.
California, again, we don't have an option. It's like you have to pass this exam, you have to have these criteria. This is what everybody is doing. Whereas
Right.
right now, you have, for example, in Finland, there are actually other associations. And we tried to kind of come together at some point, but unfortunately, like we couldn't, because all of our criteria were different. And again, not to maybe like be a little self-serving here, but we, as members of FINACU, decided that we really wanted to push for the highest standard. And
Mm.
so we pushed all of our standards up, in particular, very strongly in the Western medical like area. So like people would have to, have at least like basic education within Western medicine. I mean, going in with like no anatomy, no physiology, no like basic biology is like, it's
Yeah.
just not appropriate for a practitioner in this day and age. But as much as I think the other associations maybe even would have, or, maybe wanted to work with us, their criteria were just so far separated from ours that kind of grandfathering into each other or meshing just didn't become possible. And so that's a problem, because, some of these people have had schools for a long time. Some of these people have been in practice a long time. And I get that maybe doing a lot of extra work might not be like on everyone's agenda,
Yeah.
but for the best interest of the profession, I think that we've kind of taken the attitude that we can't do what's individually best for us. We have to do what's in the best interest of our patients and in the best interest of the profession. And that is raise the criteria right now. And that's coming from all areas, be it, academic, clinical, broadening into integrated medicine, and so forth. So,
That's so interesting that that's the place you're in, because I honestly see a lot of parallels to where we're at in California. So I've been sitting on CSOMA's board,
okay.
which, California is also very separated with a lot of different associations. And my choice in being involved with CSOMA specifically was that very much like forward thinking approach, looking at the integrative approach and not just, okay, we're over here and other medicines are over there, but look,
Mm-hmm.
integrative medicine really is the medicine of the future, and that's what patients need. And how can we make sure that our profession is a part of that conversation and that we're helping also lead the charge with that? And there's been, so much discussion about CALE and NCCAOM and, the different exams. And look, I came to
Is there any
California
progress
because
on
I
that?
wanted, I'm sorry.
what's the progress on that? Are they still separate exams? Are they
They're
merging? Like,
still separate. CSOMA, we've come out with a public statement in support of NCCAOM, and we're working with NCCAOM to try to, particularly at this time, get like grandfathered in and payment options so that people are not having to pay a full amount for NCCAOM as a California practitioner. And there's definitely pushback there because, you know, you do have these practitioners in California who took Kale forever ago and are like, look, this is a harder exam. They've had statisticians look at it. Like, that's not the case. But also what you spoke to about what's the best for the profession. You know, when we come out of this period of being cooped up in our houses, there are going to be more opportunities for us in hospitals, at the VA, and they're going to be looking for NCCAOM because that's the closest thing we have in the US to a national standard. And we just
right.
need to make sure that that's available to California licensees as well so that we don't get left behind. You know, California has a third of the acupuncturists, but the government wants a standard. So,
With
you
like,
know,
so
that
for
integrated
example,
piece is important.
so with a California practitioner, you obviously do like herbs and acupuncture together, but in, you know, the nationals, you know, you can do each section separately when you're doing the exams. But as far as I know, again, correct me if I'm wrong, but you don't have to necessarily do herbal medicine, like,
It's
or you can
dependent
do
on
them.
state. It's
Pardon?
dependent on state. So a lot
Yeah,
of states require all four of those exams. I've taken all four of the
right.
NCCAOM exams because I just wanted the freedom to be able to get licensed in whatever state. So, and that's something that, you know, you have to recertify every 4 years. A lot of the CEUs overlap for California and NCCAOM.
Uh-huh.
It's never been a big deal for me. But it's more about educating people that no, this is not going to require you to do all of this extra work and pay all of this extra money. This is what we
Right.
need for the profession to be a little more unified and move
Right.
forward. And you know, every other medical profession in the US, it's a national board
Yeah.
certification. So we just have to be mindful of that. So yeah, that's been like looking at that very integrative approach, what opportunities are going to be available to advance the profession and put money in practitioners' pockets. Like, you know, people come out of school, they don't necessarily want to start a solo practice. How are we creating more opportunities if they do want to go into a major medical system? Because that's also what patients need. Like, they need access to medicine. Like, we have to be focused
Right.
on that integrative approach. So, you know, it's interesting that there's kind of like this common goal of like, okay, how do we advance the profession and make sure that we're a part of this integrative conversation? And that's happening here in California, where we do have this history and all of this red tape. And then it's happening where you are as well, where you're like, hey, we're kind of like starting from scratch with requirements, but we all
Same
globally see there's
conversation.
a need. Yeah.
Yeah. I mean, the one thing that's interesting is that it's still ongoing. I mean, because again, I think we're around when the conversation started. I mean,
Mm-hmm.
before last elections, where it was talking about, you know, gainful employment. And I think that one of the things now, maybe being a little bit longer in this profession, I get it that not everybody is coming out of school with the same kind of start, and that wasn't something that occurred to me going in, because when I just wanted to start studying, I just fell in love with the medicine. It was something that worked for me personally. I wanted to help other people the way it helped me. It was very like personalized. But then I got out of school and I realized that, okay, me personally, like, I've always had a kind of, I guess, in a way, an easy time interacting with people, building up a practice. I'm a very hands-on person. But then I started realizing a lot of my classmates and peers were not in the same boat. Like, they were, and not that they were in any way worse practitioners, they just didn't have that same like kind of idea of business driving. And they weren't failing in like the medicine of acupuncture or
Right.
TCM. They were failing in the business of it. And it made them kind of fall apart after all this education, which they were, again, probably equally as good practitioners. But I think that talking about gainful employment and getting them into positions would allow them to practice the medicine that they've, you know, properly trained for. And I
Yeah.
think that that's something that, again, I would never have been on my radar going into this profession as even a topic. But now, as someone who's looking more at the profession on a whole and caring for the, you know, the quality of the medicine and the patient care, and also my peers, you know, I think that it's a really important topic to talk about, because again, if we're not creating positions for these people, we're assuming that everyone has to be a good entrepreneur. And we know for a fact that that's not the case. Being an entrepreneur is really hard. And here, even though I work in a local hospital, I'm still like my own business. And I know how hard that is. And I know how overwhelming it is. And there were times where I like literally was like ripping myself apart over paperwork and things that have nothing to do with whether my acupuncture is good or not. And
Right.
so I can see where people could fall apart at the seams with that. I mean, there's so many times I would love to just check in and say, hey, I just want to be employed. Like,
Yeah.
can I just get a paycheck and do my job? And because it's, that's not an option, it really makes me feel for people who struggle to maybe do that outreach and try to figure out a way. Like, this is exactly the reason, like when I got involved with the association, I was like, how do I help these people who are completely qualified, love the medicine as much as I do, are brilliant practitioners, patients want to see them, but now they have to build up this empire that they're not equipped for. So yeah, it's definitely similar conversations that have been going on for years. And definitely, even though US is a lot further along in regards to maybe kind of integrating, like you guys are just maybe a few more steps ahead than what we are. I still think that we are having the same conversations.
Yeah, absolutely.
And like I said, it might actually be better that we don't have the red tape yet and that we don't have the structure, because we can learn from what you guys have done and take all that information and be like, hey, these are the things that work. Like, it's interesting now with this school that I told you about, like KLA that Diana Mikal built. What's incredible about it is that they've taken so much modern technology into use. Like, majority of their classes that are not hands-on are online. And I mean, if you think about Emperor's Days, going to school, like all the people driving like several hours from Pasadena or some other, city further away. And obviously getting to the beach is always like a freaking pain in the butt with traffic. So if we had had the option of letting people just stay at home, do their classes online, and then only coming in for the hands-on in clinic, it would have also made a lot, like moving the classrooms around a little bit easier, because we were always fighting for the big rooms. And then of course, it just makes it easy for a student in this day and age. And even some of the classes I think are recorded, where students can then watch them in their own time. So again, it allows you to kind of be more independently studying the stuff that's anyway majority book knowledge.
I think that's going to happen more now, because people are being forced to make that transition, and people are realizing like, oh, this actually could be easier if we have this set up properly. Why do we need to have people coming in person for every single thing? Okay, we're saving all of these different costs now. I think there's going to be a huge transition to some more hybrid type of programs, because with acupuncture, obviously some things are going to have to be hands-on, and particularly in California, like we prided ourselves so much on the thousands of hours of hands-on experience that we got. So that can't go away. But, not everything needed to be done, hands-on. Like when we're doing our Western medical classes, that was something that could have been done online, that could have been done virtually. Like us sitting here talking to each other is not much different than if we were sitting talking together in person. We'd probably have some better snacks and drinks, but...
And I mean, ultimately now there's so good programs. Maybe back in the day, like it wasn't the same. Like, for example, even when we have our meetings with the association, we're using things like Zoom or whatever. And as long as it's face-to-face, it feels interactive. When I'm teaching with my students, I still teach preclinical education. And,
oh my gosh.
I know, it's like, I couldn't get out of it. It just happened. I don't know. I just love the clinic, I mean, everyone has their different areas of expertise, but for me, where it really comes together is seeing the patient, seeing the medicine work, really, working person to person. And so I kind of jumped right back into clinic, and actually with this school, KLA, I actually ended up building out their clinic. They didn't have a clinical component when I came on board. So I worked with them for about a year as their clinic director and helped them build up the clinical component, which is now actually hosted in the hospital where I work, the hospital in Helsinki. And it was a lot of it was structured off of what we did at Emperor's, like the things that we learned and you and I built together back in the day. So it was definitely like, I have so much gratitude for everything that I learned at Emperor's, and that I was given, the mentorship of all the deans and, of course, the founder, Dr. Kim, and people who we got the opportunity to learn from their 30 years of experience. Like, how does this rotate? and how do we share it? And I think that that was very much one of the things that, you know, both Dr. Kim and, you know, the senior staff there in general were always saying, like, this is about the medicine. This is about bringing it to the next step, and taking that knowledge and bringing it over here feels really like I did my job, you know?
No, exactly. I always think about what a foundation we got at Emperor's, and I think, you know, yes, the education there for the medicine is amazing, but the education that we got from everything in that clinic, working in the clinic, building out everything, deciding, you know, from, you know, the very minimal things that weren't there that were like, I think we need handbooks.
Yeah.
To, you know, what we did with like the veteran stand down, I think about that all the time.
Yeah.
We had so many amazing projects that help, I think, expose our passions and then have allowed us these different avenues to go into that really were able to still use that passion in that way. Like that was such a need. They needed somebody to help set up that clinic. And you're like, oh, I'm here, I'm back.
But what an amazing like opportunity to, I think about even like, you know, we had the ear clinic at Emperor's, and we just kind of took one thing that we were given and we were able to apply it to such a mass of individuals. And it's still, as far as I know, the program is still going and allowing veterans to get, you know, acupuncture, especially as we know, like the VA having had these like enormous wait, you know, to get into acupuncture. And as we know, like getting frequent acupuncture early on is the key to the success of the treatment of like things like PTSD, or, you know, avoiding potential symptoms of PTSD. So I think that being able to provide something like that, based off some knowledge and then bringing it into the next step, like it, in the moment, you weren't even thinking about anything but just creating this opportunity. But then when I look back at it, I'm like, wow, that was both very giving for me to be able to offer this and be able to build something, and not in a personal gratifying way, just to be able to see these people actually get the help of the medicine that I so love. But then going back, I was like, oh, it was such a personal growing experience too, to build a clinic and see that it's really possible. Like, you just have to be proactive. Like, sometimes people think that, oh, well, what difference can I make as one person? Or, you know, oh, the medical system is so big and it's so, you know, uphill battle all the time. And it's true in some ways. Of course, you have to do what's in the best interest of the patient. You can't just be willy-nilly. Like, you have to come with something good. But when you do, in the way that we did with the VA, they were open and they were, you know, willing to kind of work with us because we came with something that was workable, I guess,
Yeah.
you know?
But also it exposed a need. Like I was so surprised by what a need was exposed. So like last year I went to ASA's national conference, and then the day after the conference they had a congressional fly-in. So we went to different congressional offices to advocate for bills in our medicine. And one of them was acupuncture for our heroes, and it had to do with veterans' access to a licensed acupuncturist at the VAs.
Right.
And it was so easy to speak to because we had done it. And when, a congresswoman or a senator is asking, well, what's the need for it? Like, are veterans even interested in this? To be able to speak to, absolutely they are. And I would say even more so than the general public. The way that we were received working with all of these veterans, whether it's at the convention center, the different VAs, when we set up those satellite programs, it was amazing, the openness and the desire for that kind of help, and acupuncture as a modality to help with a lot of common issues that veterans are experiencing. So I think, you know, doing these new innovative and integrative things really does expose some needs and some pain points, and helps kind of pave the way for future opportunities for people.
Yeah, I mean, that's one of the reasons even the hospital where I'm working now, as I said, why I was so excited to start working with them is because the chairman or chairwoman, she actually has been very pro integrative health and really like giving the patients the opportunity to choose these different modalities of treatment, and not, you know, solely one or the other, but also working integratively. And you know, from early on, I was kind of pushed to work with the doctors in-house and try to keep the patients indoors to make sure that we could kind of keep, you know, multiple perspectives on these patients who needed maybe, you know, more specialized care. And because this is a private hospital in Finland, they are able to offer things that maybe the general healthcare doesn't offer. And
Mhm.
I mean, mind you, for those who don't know, like Finland has an incredible healthcare system. I mean, again, as you know, like I'm in my last few weeks of pregnancy. So, you know, the maternity care here has been like absolutely like amazing. And realizing that this is something that I have access to just as a Finnish citizen is astounding. Like it's just having been in the US for so long and you know, maybe having a little more complications with the healthcare system.
Mhm.
I've really learned to value what I get here just being a Finnish citizen. But that being said, you know, this isn't one of the few like private hospitals that offers maybe some of the care that wouldn't be offered as standardized care. And so the welcoming that we get as kind of complementary and integrative care has been superb, and just really cool to see that there are people who are open to this and really have their eye on the future of offering people, you know, kind of multi-directional treatments that are not just based off one thing, but again, working together as a team. So I think, again, the VA was actually so much more liberal than I ever had expected. Like I thought we were going to meet with the military an
Mhm.
incredibly like strong wall of no's.
Right.
And it was the opposite. It was like the, oh my God, please, yes, like we'll take the help.
Yes.
Yes, we want to work with you. Let's do this. And that was really incredible to see. And I'm not really sure if it was because, you know, we happened to be coming in the time where the opioid crisis was really like at a ultimate kind of, you know, I'm sure it's still at an ultimate high, but it was very like visual at that time. So it kind of came in perfect timing. Or if it was just something that seriously they've really been struggling before and it just, we happened to be a good, you know, fit at the time. But yeah, I was really surprised how open they were, because when you think military, open is not really like the first thing that you're thinking
No.
of. They were amazing. Yeah. And such
Yeah,
cool people. I mean, we met so many amazing individuals during that process.
we did.
So
And so many people got involved with it. Like so many instructors, so many
mhm.
supervisors, so many students. It just really provided an incredible opportunity for so many different people to see all the various layers of, you know, how you can help with this medicine. So I am, yeah, forever thankful for those opportunities. So
and also
I could literally talk to you all day, Lisa. I'm like checking the clock. Okay, I have a couple minutes and then I have a patient. But
we
yeah,
can always do this again, catch up another time.
we
But
need to do it again. It's so good to hear from you, and I miss working with you on a day-to-day basis. Like I miss
right.
having that like person who can run with me, like or it's like, oh, let's set up an entire clinic at the convention center and treat thousands of people over a few days. Okay, great, let's make it happen. Let's create a system. So, what did you say? Harvey and Mike.
Oh, I know. I can't believe when I came in, like even like after I'd left, like a year later, our little like suits picture was still on the wall. I think Janelle had taken over the office by that point, but she still kept it up there.
She's
I'm
like,
actually cute.
I can't take it down. You guys would get so upset.
Oh, it was great, and I mean, like I said, it's been a really huge adjustment, like moving out here. But at the same time, I'm really optimistic. I think Finland is we're really progressive in some ways, and I think that the Finnish people are very practical and they have a good view on like how to like still keep traditional, keep things like, you know, reasonable, but they're also not closed off. And I think people do like, I mean, we still have, you know, so to say, traditional medicines here, and people still kind of rely on like just good, healthy foods and, you know, basic lifestyle stuff to stay healthy here. So I think the mentality is right. And I'm really like, I'm hoping that with the work that we're doing with the school, the association, you know, integrating with the hospitals right now, that Finland for once might be the progressive country instead of waiting on like
Yeah.
Sweden or some other country to take the step first, that they might just be like, you know what, acupuncture is here to stay. I really want to like be the one step ahead and we're going to just integrate. Like I'm hoping that Finland will do this. I don't know if they will, but like my hope is that maybe once historically we might be the first ones to do it instead of waiting to like let others decide, because I think we're capable of it.
Okay. Well, the little I know about Finland, I know through you, and I have faith in you and your and projects you decide to get involved in. So I don't know. I think it's a great time for it. I think you know, you do have an opportunity not having the red tape. And I think everything is kind of just like turned upside down right now. And there are going to be so many opportunities for new progressive ideas moving forward. Like people know things have to change. So I think it's
Certainly.
actually a really great time to kind of like regroup and then just push forward.
Absolutely. It's, I mean, the timing is perfect. And ultimately, as you said, I think sometimes having a more open platform allows you to do more than having to work within, you know, boundaries. So just see, before we bounce out, I see that our fellow acupuncturist, Gretchen Badami, just says, "Hey, ladies." So
Oh,
Nell
hi, Gretchen.
Embers.
And then Molly had said hi to us too. So hi,
Oh, right on.
Molly. Yeah, I'm like scrolling way back. But yeah, Lisa, we'll do this again because I want to hear updates about how things are getting pushed forward in Finland, and I want to have more updates about how things are progressing in California and the US too. So I'm happy that even though I miss you, I feel like the profession needed a split so we can help in our respective areas. And then maybe someday we will join back together again.
Oh, definitely. Our like team, you know, you, Chris, Gretchen,
Oh,
Nicole, yeah, we're gonna have to bring the dream team back together at some point when the time is right.
exactly. All right. Well, so good talking to you, and let's talk soon and have someone kiss your belly for me.
My partner's good. He has morning kisses every day, so the baby is well kissed.
I'm so happy for you. So let's
Right
talk
on.
soon.
So nice to see you.
You
Let's do this
too.
again soon. We'll
Yes,
keep catching up on the global acupuncture world.
absolutely. All right.
All right.
Bye.
Bye.